A longitudinal study of cancer risk versus 5 influential factors using neural network, AI and viscoplastic energy models. Number 1248, VMT Sharp 631, April 15, 2025. Gerald C. eclaireMD Foundation. Category: Cancer, and Methodology. Abstract. Introduction and background. Cancer is a leading cause of death worldwide and a major concern for patients. While genetic and environmental factors influence cancer risk, excess body weight and visceral fat, plus certain key lifestyle behaviors remain the most modifiable and actionable components for prevention. Historically, more than 90% of medical research has relied on traditional statistical tools, such as regression models, ANOVA, and survival analysis, to examine population-level data in pathology, physiology, and pharmacology. While useful, these statistical methods often fall short in capturing the individualized, nonlinear, dynamic and cumulative impact of long-term lifestyle behaviors and weight fluctuations on cancer risk. In recent years, advanced analytical tools, such as artificial intelligence, AI, machine learning, neural networks, and systems-based simulations, have been introduced in medical research. Though their use remains limited, the author applies an innovative dual method approach that combines a viscoplastic energy model, VMT, adapted from engineering mechanics, with a neural network model, NNM, based on AI. Together, these two research methods provide a comprehensive framework to assess cancer risk, by analyzing both the long-term, physiological burden and short-term daily fluctuations of influential factors. Over 11 plus years, 2014 to 2025, the author collected 4,118 days of his personal health data, comprising more than 24,000 records. These include daily estimated cancer risk probabilities and 5 key variables. 1. Carbohydrate and sugar intake, grams. 2. Food portion size, grams or percentages. 3. Body weight, pounds. 4. Visceral fat, percent. 5. Walking steps, count. The author abstains from smoking, alcohol, illicit drugs, and high-risk environmental exposures. Therefore, these 5 variables, strongly associated with obesity, metabolic dysfunctions, chronic inflammation, and cancer, were selected for this study. This dual method study proceeds as follows. NNM analyzes over 24,000 daily data points to identify outliers, data points deviating from learned healthy ranges, and assesses each factor's short-term impact on cancer risk using 2D spatial diagrams. VMT processes 72 annualized data points, 6 variables across 12 years, to quantify cumulative deviations from health thresholds, as energy-based cancer strain values, offering a macroscopic view of long-term risk. Together, these two research models offer a non-statistical, dual perspective approach for individualized cancer risk analysis, data structure and methodology. The study employs 2 independent yet complementary analytical models to examine how 5 lifestyle and weight-related factors affect his cancer risk from January 1, 2014, to April 13, 2025, 4,118 days. All data were self-collected and analyzed by the author. Input variables, with normalized reference values. 1. Body weight, 170 pounds. 2. Visceral fat, 13%. 3. Carbohydrate and sugar intake, 30 grams per meal. 4. Food portion size, 680 grams per meal. 5. Walking steps, 10,000 per day. Neural network model, NNM, analyzes over 24,000 daily records, includes approximately 4,200 complete daily entries with cancer risk estimates, identifies outliers and evaluates each factor's short-term impact. Viscoplastic Energy Model, VMT, processes 72 annualized datasets, 5 input variables plus cancer risk over 12 years, converts deviations from healthy thresholds into energy-based strain values, representing cumulative cancer risk. This combined approach integrates detailed day-level outlier detection with long-term cumulative stress strain analysis to reveal how weight and lifestyle patterns contribute to his cancer risk. Analysis results. 1. Macro view from Viscoplastic Energy Model, VMT. The VMT analysis reveals the ranked energy contribution to cancer risk. Visceral fat, 25.9%. Body weight, 25.5%. Food portion size, 17.6%. Walking exercise, 17.5%. Carbohydrate and sugar, 13.4%. From a long-term energy strain perspective, visceral fat and body weight are the top contributors, each about 26%, followed by food portion size and walking exercise, each around 17.5%. Carbohydrate and sugar intake, while critical in diabetes, ranks lowest, 13.4%, in its impact on cancer risk among these 5 factors. 2. Micro view from Neural Network Model, NNM. The NNM analysis identifies outlier counts from 24,000 records. 8,236 data points per factor across 5 analyses. Visceral fat, 28, 0.66%. Carbohydrate and sugar, 28, 0.78%. Body weight, 11, 0.24%. Food portion size, 3, 0.06%. Walking steps, 0, 0.0%. Visceral fat and carbohydrate and sugar intake had the highest number of outliers, 28, each, marking them as key short-term disruptors. Body weight followed with 11 outliers. Food portion size showed minimal impact, and walking steps showed none. From 2014 to 2025, the author consistently walked between 12,000 and 18,000 steps daily, averaging 15,000. Academic conclusion. The macro-level VMT model is based on physics and engineering principles, while the micro-level NNM model derives from computer science. Both are deeply rooted in mathematics and offer quantitative insights. In contrast, traditional biomedicine, grounded in biology and chemistry, relies more on qualitative analysis, through clinical observation and experience. Despite differing academic origins and methodologies, each approach offers valuable perspectives. Their shared goal is to identify root causes, describe disease mechanisms, and guide both physicians and patients toward effective actions. Ultimately, the highest purpose of medicine is to preserve health and save lives, regardless of the method used. Appendix A. Author's notes on study design and applicability. 1. Genetic and environmental exclusions. Genetic predisposition operates as a binary switch in cancer development, either present, a yes condition, or absent, a no condition. The author does not engage in smoking, alcohol consumption, or illicit drug use, nor does he live in a polluted or toxic environment. Therefore, no personal behavior data related to these non-lifestyle risk factors were collected or included in this study. The research focus is limited strictly to modifiable lifestyle behaviors and physiological indicators. 2. Reproducibility and individual variability. Should other individuals collect a comparable volume of daily health data and apply the same analytical models and methodologies described in this paper, some variation in outcomes is expected, due to physiological and behavioral differences. However, unless there are substantial disparities in body weight, visceral fat percentage, dietary practices, or physical activity levels, the overall directional trends, behavioral patterns, and resulting conclusions should align closely with those presented here. 3. Comparison with public health data. Although large-scale public health studies may reveal similar high-level patterns, they differ fundamentally from individualized research. Personalized medical analysis, such as that conducted in this study, can uncover patient-specific risk factors and behavioral triggers that are typically obscured in population-level data. In essence, individuals who effectively manage their body, weight and visceral fat, adopt balanced diets, and maintain regular physical activity, are highly likely to experience a measurable reduction in their cancer risks. Final reflection. This study demonstrates how a highly granular, individualized data approach, powered by AI and physics-based modeling, can offer valuable insights into cancer risk management. While public health studies remain important for general guidance, individualized medicine holds the key to precise, actionable prevention strategies, tailored to each person's unique physiology and lifestyle.